I said, do you think it's a big deal? Because the president...
You are going to describe... The purpose of this press conference is our response to the governor's proposal of his budget. I am here with our partners with the HHS network. The HHS network and the people it represents are calling on California state leadership and legislators to stand with us and protect all immigrants by keeping families together, safe, and healthy. Preserve recent healthcare gains that reduce the number of uninsured to all-time lows. Defend the Social Security safety net programs like Medi-Cal, CalWORKS, CalFresh, SSI, and IHSS. Nearly 1 in 4 children lives in poverty, and here in Kern County, that number is even higher. Here in Kern County, over 30% of the children are living in poverty. I don't feel that that's acceptable.
As an organization, we believe that health care is a basic human right, and that we have really been pushing towards universal coverage for everyone, regardless of immigration status. And we've come a long ways with the Affordable Care Act, and and certainly California has taken a lead, and this year included undocumented children through SB 75. And so we've made great strides, but yet with what's going on at the federal government, we're seeing tremendous threats to all the gains that we've made in recent years. And California plays a critical role in helping to put pressure on our federal government to preserve the programs that we have in place to fix what's broken. The whole thing is that, Obamacare overall is really working well, especially in California, where we've been able to insure millions of people in this country with affordable, quality health care. We still have a ways to go, but if we don't have the Affordable Care Act as a foundation, coverage for all people will become less of a reality. And so we're really wanting to put a lot of pressure on our federal government. All of us have to raise our voices and not to go silently into the night with these proposed threats to the work and progress that we've made already. I was on a briefing just before this press conference from Diane Dooley, who is Secretary of Health and Human Services for the state of California. And one of the good news that I heard was that SB 75 was not going to be affected in any way, that it was going to continue forward, so those children that were enrolled in this program will continue to be enrolled. One of the negative things that we did here is that affects community health centers like Clinica Sierra Vista is that they're going to delay the plans to be able to utilize marriage and family therapists in health centers until there is more stable funding, because the governor is anticipating a drop in revenue and healthcare costs are going up, and so they're having to fill the gaps with funding from Prop 56 as well as general funds just to maintain services at the current level. So we're very disappointed in that, because what that means is that decreases access for mental health and behavioral health services for children, families, and adults in health centers, because we cannot bill for those services. And there's a shortage of licensed clinical social workers who can be billed, and so there's twice as many marriage and family therapists in California as there is LCSW. So that is a real disappointment in what's happening. But we have to, let the governor and our state legislature know that these are things that they need to really take a serious look at. If we delay implementing some of these programs, it's going to cost the state of California even more money when people don't have access to care for preventative services. And access to mental health, behavioral health services is really critical.
Every day I advocate in the best interest of my patients, and I will continue to do so. I want to make sure that with this proposed budget that we cover everybody in our community with health care. We see what happens every day. People are choosing between putting food on the table, cutting their pills in half, or not taking their medications that can keep them healthy. So as nurses, we do want to advocate very strongly for our community. We want to urge the governor not to cut social programs that will affect the public health and safety. And it goes beyond that. We have so many that are living in poverty. When you live in poverty, you can't afford food, you can't afford the medication to keep you healthy, and you can't afford to see the doctor on a regular basis. So what do I see? On my operating room table, I see much worse conditions, things that could have been prevented. Healthcare is a human right. We need to stand up and rise up and make sure that that happens. We need to put the priorities where they belong. We need to put people first over profits. We do believe in a single-payer system that's comprehensive, everybody in, nobody out. Obamacare is a huge step in the right direction. There are so many more covered than were before. And the children of our nation deserve to be able to have a full belly when they're going to school so that they can learn properly. We need to make sure that our schools are properly staffed. So there are a lot of priorities here, and we want to make sure that our governor knows that our communities are going to take nothing less than what we need to make sure that our communities are healthy. Thank you.
I think that it is really important that we continue to fight for our immigrant brothers and sisters, for seniors, for our children, and that's why I'm here today. That's why I'm standing here in support, and I believe California, being the most progressive state in the union, needs to come to the table and lead the nation, and really show them that these social programs really do work and help bring people out of poverty. So build schools, not prisons. No human is illegal, and healthcare for all.
I'd like to start with a paragraph from 5 facts everyone should know about poverty from the California Budget Project. Poverty is not an inevitable feature of our society. By expanding and improving how our nation supports low-income families and individuals, public policies from Social Security to food assistance to tax credits for working families have played a key role in reducing poverty in the last half-century. These policies continue to be a powerful tools for lessening economic hardships today. I am a Faith and Value leader. I am also a parishioner at St. Joseph's Roman Catholic Church. And this statement should be something that our pastors, our priests, our clergy should be preaching from the pulpit. My intention now is because my sin was being so ignorant about the whole budget process, and I've become more educated. So to pursue my Christian values, I am going to study the budget process. I am going to talk to the people at church to state that it's okay to do, corporate acts of mercy, have soup lines and give out, turkeys during, Thanksgiving and Christmas. But this is the real work here. People are hungry all year long, not just around the holidays to make us feel good. So I'm asking my Christian brothers and sisters to really get involved, study the budget, let's practice our Christian values, and really do God's work in trying to take care of the most vulnerable, most marginalized of our society.
We need leaders to see California's poverty crisis with clear eyes and make lasting revenue solutions a priority in our state in order to help every Californian to a place of dignity. During the last 6 years of budget cuts and austerity measures, the number of Californians in poverty spiraled, and our poverty rate increased 7 times faster than the rest of the nation. And one last point to leave us on. Parents continue to be faced with working in a job that doesn't pay enough, while affordable childcare is still out of reach. Thank you everyone for coming out. I appreciate you coming to the press conference, and thank you very much to our partners.